Imagine this. You break your arm, walk into a US hospital, leave with a bill higher than the price of a brand new iPhone. Shocking? Let us break down why healthcare in America is so expensive and how you can avoid going broke. Healthcare in the United States is one of the most expensive in the world. We're talking about costs so high that even people with jobs, savings, and insurance can end up buried in medical debt. But where does all this money go? What can you do to protect yourself? A single day in an American hospital averages $2,800. That's per day, not per treatment. Emergency room visits start at around $1,200 for something simple like stitches. Can easily hit $3,000, $5,000 if tests or scans are involved. Need surgery? A simple appendectomy, removing your appendix, can cost between $10,000 and $35,000 depending on the hospital. And giving birth? The average price for an uncomplicated delivery is about $13,000. But if there are complications, you could be looking at $30,000 or more. And that's not all. Prescription medication in the US is notoriously expensive. Insulin, a life-saving drug for diabetics, costs about $300 per vial without insurance, and many patients need multiple vials per month. Even basic pain relievers or antibiotics can be 2 to 3 times more expensive than in other countries. Then you have facility fees, charges just for walking into the building, sometimes hundreds of dollars before you even see a doctor. So why are US healthcare costs so high? It's a mix of factors. Administrative overhead. The US healthcare system is incredibly complex, with multiple layers of billing and insurance paperwork. It's higher prices for drugs and medical devices. Unlike other countries, the US doesn't regulate prices as strictly. Specialist-driven care. More tests, more procedures, more bills. And frankly, the profit motive. Many hospitals are private businesses. Consider Sarah, a 28-year-old teacher from Texas. She slipped on the stairs, broke her ankle, and needed surgery. Her bill? $47,000. Even after insurance covered part of it, she still owed over $14,000. Or Mike, a college student who got appendicitis. He went to the ER, had emergency surgery, and walked out with $38,000 in debt because his insurance didn't fully cover out-of-network care. These are not rare stories. They happen every day. So what can you do to avoid financial disaster? Get insured. Even if you're young and healthy, accidents happen. Shop for the right plan. Compare coverage every year. What's cheap now might be costly later. Use urgent care. For non-life-threatening issues, urgent care centers are much cheaper than ER visits. Ask for itemized bills. Up to 80% of hospital bills have errors. Negotiate. Many hospitals will reduce your bill if you ask and explain your situation. Consider telehealth. Cheaper and more convenient for minor illnesses. Build an emergency fund. Even $1,000 saved can make a difference in avoiding debt. Healthcare in America is expensive. There's no denying it. But understanding the costs, planning ahead, knowing your options, can mean the difference between a temporary setback and years of crushing debt. If you found this helpful, hit the subscribe button for more tips on money, health, and living smart in the US. And remember, your health is priceless, but it doesn't have to cost you everything.